Hello, I'm Dr. Poornima, one of the consultant in OBGYN department in Aster RV Hospital. Today, I'll be talking on missed periods. What is missed period? If a woman who's expecting her period on a certain day and if she misses it or if there's a delayed cycle, then it's called a missed period. The period can be as short as 21 days to 35 days, sometimes considered as 40 days as well. And what are the common causes of this? Now, if the woman is in a reproductive age group, something around 14 to 50, first we have to rule out pregnancy. Now, this is done by a simple urine pregnancy test or a beta HCG, which is a hormone blood test, or an ultrasound. This is done 3 weeks after the unprotected intercourse which has taken place, or 5 weeks after the 4 or 5 weeks after the first day of period. Now, if pregnancy is suspected, if there is a condom breakage, or if she has missed her pills, or she has delayed taking her birth control injections, or even an implanted device is out of place, pregnancy can happen. The other common reasons are stress. Stress or deadlines to meet, either in family or career wise, can make the periods prolonged or delayed or even missed. Now, other things are low body weight or the other excessive body weight. Low body weight in certain conditions like anorexia nervosa, there is not enough fat in the body to maintain a normal menstrual cycle. Periods can get delayed or even missed. So around 17 to 22% of body weight is required, body fat is required to maintain the regular menstrual cycle. And to tell about excessive body weight, when there is obesity, when the body mass index, which is above the normal, more than 25 or 30, what happens is the excessive fat cells produce hormone called estrogens. Estrogens make the lining of the womb with irregular patches and irregular bleeding, and sometimes periods can get missed or delayed. And the other conditions are certain medical conditions where there's uncontrolled diabetes, blood pressure, thyroid abnormalities can also lead to irregular menstrual cycles, and thus the periods getting missed or delayed. And certain gynecological conditions, what we commonly hear, PCOS, this can also present with irregular menstrual cycles, so the periods getting missed because there are a lot of small cysts in both the ovaries. They're not ovulating, they're not producing an egg, and thus irregular signaling to the uterus lining or the womb lining, and there is no shedding, and the period is thus missed. And the other one which is coming up in a rising trend is diminished ovarian reserve, which is misdiagnosed as polycystic ovaries. There are not enough eggs, or the woman's ovaries are failing, and that is why the periods might get delayed or missed altogether. So if any of you are experiencing a missed period, do visit us at Aster and we will check you out. Thank you.